Hi there. My name is Vin Calatavito, and on behalf of the ISTH Congress Daily News, I have the privilege to be joined by Dr. Jean Connors, who is Associate Editor of the Journal of Thrombosis and Haemostasis, or JTH. Greetings again, Jean.
Hi, Vin. Thank you for having me here.
Of course. So the focus of today's conversation is around the JTH in Clinic series. So I'd like to kick things off, Jean, if you can tell us a little bit about yourself and your role with the JTH.
Well, thanks, Vin. I'm a coagulation hematologist based in Boston, Massachusetts at Brigham and Women's Hospital, Dana-Farber Cancer Institute, and Harvard Medical School. And I oversee a wide variety of anticoagulation management services and the use of hemostatic and anticoagulant agents in the hospital. I'm the co-chair of the SSC on perioperative and critical care medicine for ISTH. And at JTH, I'm delighted to work with everybody on board, both the editors-in-chief, David Lillicrap and Jim Morrissey, as well as my co-associate editors, to review manuscripts for JTH.
Great. So what exactly is the JTH in Clinic series?
JTH in Clinic is a new manuscript series that was just launched in January 2021. Each manuscript is a case-based discussion that addresses clinical disorders of thrombosis and hemostasis for which limited data or management exist. These manuscripts are authored by senior experts in the field who briefly review current knowledge, but add their own experience and perspective about how to manage these patients to give optimal advice and how to use current diagnostic and treatment strategies for these disorders of thrombosis and hemostasis. The JTH in Clinic series is important because many disorders of thrombosis and hemostasis occur infrequently in small numbers of people. Data from what we consider gold standard randomized controlled trials about how best to manage people are not available in these patient populations due to the low prevalence of disease. So rigorous grade methodology guidelines do not exist for these patients. These patients we consider somewhat niche populations. New diagnostic tests and treatments are rapidly available, but without that rigorous grade methodology guidelines, clinicians in practice aren't sure how to use these treatments and how to work them into the care of specific patients. That's where JTH comes in to sort of fill this knowledge gap between rigorous methodology by using expert advice and opinion to help clinicians in practice understand how to manage the patient in front of them.
It's great to hear about filling those gaps, those knowledge gaps that are really important in the constantly evolving space that you as a provider and your colleagues live on a day-to-day basis. So what do you and your colleagues, the other editors, hope to see with the overall JTH in Clinic series in the future?
Well, right now, we hope that clinicians are already finding what's been published useful. Going forward, we value input as to areas that need to be addressed by practicing clinicians. And we hope the series moves forward and stays pace and stays current with newly available diagnostic strategies, treatments, and management strategies.
So, Jean, got to ask, where should someone go to submit their paper?
There's two aspects or two answers to that question. First, please go to the JTH-ISTH.org website and look at manuscript types under the author section. But the caveat is that we would prefer that you contact us directly, the editors-in-chief or myself, prior to writing your manuscript. So that we can make sure it's appropriate for the JTH in Clinic series. Please send us any proposals that you have, and we will work with you to make them fit our model and what we envision for JTH in Clinic.
Appreciate that information, Jean. So for anyone that would like to, going one of those two paths, they can definitely get some more background information off of jth.isth.org. So thank you so much, Jean. Really appreciate the time and effort today.
Thank you, Vin, and thank you, and I hope to see you all at the ISTH meeting.
Until next time, I'm Vin Caldovito for ISTH Congress Daily News.